From my other home, the San Francisco Bay Area, we've got Eric here from Oakland from Frontier Bio. Let's give him a round of applause.
Good evening. My name is Eric Bennett. I'm the founder of Frontier Bio. We make an advanced 3D bioprinter. But what is bioprinting? So bioprinting uses human cells to 3D print human tissue. It's not possible today to print complex human organs, but it is possible to apply 3D bioprinting to one of the biggest problems this world has, and that is cancer. So 9.6 million people died of cancer in 2018. 1 in 6 deaths is due to cancer. Drug developers try to develop a solution, but unfortunately 95% of anti-cancer drugs fail in the human trial phase. They'll spend millions of dollars and years of research on animal studies only to find that the drug does not work in humans or has terrible side effects. So why not test on human tissues from the start? That's where bioprinting can help, but bioprinting has 2 major problems. Problem number 1 is that up to 60% of cells die just from the bioprinting process itself. Number 2 is that conventional bioprinting techniques print only at the micro scale. Real tissues have nanoscale features that can't be replicated with conventional techniques. These 2 problems combined result in failed prints and limits the kinds of tissues that you can print. So that's why I founded Frontier Bio. We make an all-in-one bioprinting platform that overcomes these limitations by combining multiple techniques in one machine. This is what the bioprinter looks like, and these are prints from the machine. And this machine we actually ship to the Mayo Clinic, the #1 hospital in the US. And how does it work? How do we do this? How do we overcome these limitations? We combine conventional bioprinting techniques with something called electrohydrodynamic printing. With this, we can print down to 0% cell death and at the micro and nano scales in the same machine, and it's patent pending. These figures show 3 different ways we can use an electric field to deposit material, including cells. So we'll begin by selling hardware. Our bioprinting platform will go for $84,000, and we can also sell consumables. These will be bioinks. Every time the user uses the printer, they'll need a bioink, and they can purchase that from us. Go back one. We'll also develop tissues for pharmaceutical companies. These will be cancer tissue arrays that pharmaceutical companies can use to develop drugs against cancer in a high throughput way and an effective way, better than animal studies. So the total available market is over $100 billion. Due to regulations and other factors, the available serviceable market is $29 billion, and we're aiming to capture 1% of that, which is $290 million annually. In terms of traction, we sold 2 discounted bioprinters to the Mayo Clinic. They're using these bioprinters to print blood vessels, human blood vessels, and they're replacing some of their animal studies already with this machine. We sold scaffolds and other things to several other institutions, shown on the right there, and we're speaking with several other institutions about selling more bioprinters for our pilot program. We do have competition, of course, but the key takeaway from this slide is that all of these competitors, they rely on a conventional bioprinting technique, so they suffer from those 2 major problems I mentioned earlier. Only Frontier Bio can print at both the micro and nano scales and with up to 100% cell viability. So this results in superior print quality and tissues that better replicate real human tissue. So the team consists of 3 core team members. I have over 4 years experience developing bioprinting technology. Matt has over 10 years experience at Lockheed Martin, has an MBA. And Alexander is an MIT engineer, and he has a background in product design, aerospace, and robotics. There's a Stanford tissue engineer joining soon. He has over 40 publications in tissue engineering, bioprinting, and biomaterials. We have a great team of advisors. George Church is a pioneer in the field of biotech. He's pioneered many technologies. Rami is a bioprinting expert for medical applications, and Louise is a successful entrepreneur with a background in hardware and B2B business. We're raising $1 million to continue developing our bioprinter and develop our bioinks. We'll also grow our team and launch a pilot program with 5 other institutions, representing about $400,000 of revenue. We'll also develop cancer tissue arrays for pharmaceutical companies to develop those anti-cancer drugs in a high throughput and effective way. So I invite you to come visit me at my booth. I can show videos of the bioprinter in action. See you later.
Thank you, Eric. I'll let you pass both off. I know a lot of us have probably been affected, or known a family member that's been affected by cancer, so really excited to see the work that they do.